As you may know, aspirin is sometimes used for prevention of heart disease, particularly to reduce the risk of heart attack or stroke in certain individuals. Its role is primarily linked to its antiplatelet effects, which help prevent blood clots from forming. However, its use for prevention is nuanced and depends on individual risk factors, as it carries potential risks like bleeding. The US Preventative Services Task Force in 2022 recommended against initiating low-dose aspirin for primary prevention in adults over 60, and decisions for those 40 to 59 should be individualized based on risk factors. So, needless to say, the above guidelines didn't go far enough to clear the air in aspirin use in prevention of heart disease. Today, we are diving into a fascinating study that could change how we think about taking aspirin to prevent heart disease. Let's break it down. A 2020 study published in JAMA Cardiology looked at something called coronary artery calcium or CAC score to figure out who might actually benefit from aspirin and who might not. So, what's CAC score? It's a measure of calcium buildup in your heart's arteries detected through a quick CT scan. The higher your score, more plaque you got, and higher your risk for atherosclerotic cardiovascular disease or ASCVD, which includes things like heart attacks and strokes. Here is where it gets interesting. The study found that people with higher CAC scores, say above 100, have a greater risk for both heart problems and bleeding events like stomach bleeds, which can be a side effect of aspirin. But the link to heart disease was stronger. So, for folks with a high CAC score, aspirin might reduce their heart attack risk more than it increases their bleeding risk, but only if their bleeding risk is low to begin with. Let's break it down. If your CAC score is high and your risk of bleeding is low, maybe you don't have a history of ulcers or other bleeding issues, aspirin might be net win for you. But if your bleeding risk is high, the study says aspirin could do more harm than good, no matter your CAC score. And if your CAC score is 0, you're likely at low risk for heart disease, so aspirin probably isn't necessary. This study is a game changer because it shows how a simple heart scan can help doctors personalize aspirin therapy. It's not a one-size-fits-all approach anymore. So, what's the takeaway? If you're over 40 and thinking about aspirin for heart disease prevention, talk to your doctor about getting a CAC scan. It could be the key to figuring out if aspirin is right for you.